Hello, and welcome to another virtual field trip from the Ken Sealing Waterloo Region Museum. In this episode, we'll find out about the life of someone who went overseas. What image comes to mind? Probably a soldier in the trenches, but there were other people there, including women. Today we're going to find out about the life of Maude Bowman, who served as a nursing sister during the Great War. Maude was born in Waterloo Region in 1885, and today most of the photos that you'll see are from Maude's personal albums. They were taken by her or by people with whom she served. Maude grew up on a farm on Wilmot Township, along with her twin sister Mabel and younger brother Edgar and younger sister Edna. She decided when she finished school that she wanted to be a nurse. So she went to the General and Marine Hospital in St. Catharines, Ontario, where she trained and graduated as a nurse in 1913. This was a time when few women continued on to higher education. Remember that year, 1913? What happens the next year? Yes, August 1914, war begins. What will Maude do? Well, there was a need for trained nurses and medical personnel, so Maude enlisted and sailed for England in May 1915. That was 10 months after the outbreak of war, so she was part of the first wave of enlistments. Maude was part of a group assigned to the No. 5 Canadian Stationary Hospital that was going to be located in Cairo, Alexandria, and Port Said, Egypt. She set sail aboard the Mauretania for the Mediterranean on August 14, 1915. Maude and others were there to establish a 600-bed hospital in Egypt that was going to serve the casualties of Gallipoli or the Dardanelles campaign. They quickly had to expand to over 1,000 beds. Although Maude was busy helping set up the hospital and caring for more and more patients, there was time, occasionally, to explore the area. Here's a picture of Maude on leave with two other nurses. Maude's the one in the middle. Remember the need for more beds in the hospital? The Gallipoli campaign was a failure, and the Allied troops withdrew. With the end of the Gallipoli campaign, the hospital in Egypt packed up, and Maude returned to England, where she re-enlisted for service in France. This is her attestation papers, or record of enlistment, in August 1916. Maude was soon serving in France at a hospital set up in Étaples, the No. 7 Queen's Canadian General Hospital. This hospital had room for 2,300 beds and was often full. There's a railway just at the tree line here and the coast beyond. The cross on the roof, what's it there for? Well, that helps identify that this is a hospital to anyone flying over. And they needed it because by this point in the war, there were actually air raids. So what happens there? Well, after a battle, there are the wounded who need to be treated. And the first casualties had to be evacuated from the front lines by stretcher bearers, and they were initially assessed and treated in tents at the front by male medical orderlies. They were then transferred to trains or ambulance convoys, as seen here, to be delivered to the hospital. Maude would have served many roles as a nurse, and it included being part of ambulance convoys. These young women are friends of hers, although she's not in this picture. Once the convoy reaches the hospital, they would arrive in various conditions and have to be treated all at once, particularly after a battle. Now, I want you to think about if you've ever been in an emergency ward, either as a patient or accompanying someone. Think about how you felt. Imagine all these men lying there, not knowing their fate or that of their friends. They're in pain, they're scared, and suddenly the nurses appear. The nurses were sometimes called bluebirds because of their uniform. You'll see in a picture here what the uniforms looked like. First off was a surgical dressing tent that could be used for minor wounds. Any wound was a risk because it could become infected and life-threatening. There were very few things that could be done with infection. There's a cabinet in the foreground that has some equipment that we actually have some like it in the gallery. Some of the portable equipment like folding stools, surgical equipment. The equipment was portable for use in tents and temporary shelters. Once they'd been treated and assessed, the badly wounded went to surgery to be treated as quickly as possible. Some faced lengthy convalescence, or they might not be able to return to the front and they would be sent to England for further treatment. The following is an excerpt from a diary of a nurse who served in the same unit as Maude and would certainly have known her. Gassed cases were distributed to tent hospitals, and we had our share. Those sisters who now were winning their way to clearing stations or who were attached to hospital trains had told us of the diabolical sufferings and cruel deaths of the victims of German chemistry. One very bad case became our star patient. His cyanosed face was the color of mahogany, and for 2 weeks he breathed only from oxygen cylinders. 2 special nurses were assigned to his care for several days. To the amazement of everyone, he recovered, walked with assistants along the grassy paths one day, cheered by his sympathetic comrades, and saw England again. This is an excerpt from Our Bit, Memories of War Service by a Canadian Nursing Sister, written by Mabel B. Clint. Take a look at this hospital ward. Remember, this is basically a temporary structure. The soldiers are in cots, but they've done things to try to make this more pleasant for the soldiers. There was even a recreation area that could provide sports. They had a baseball team, and Maude would spend time here as well. Think about what you would want to have available and what you see in this picture that was part of their entertainment. Now remember what that ward looks like. We're going to see it again in a different state because in May 1918, the hospital was bombed several times from the air. Air raids were becoming more common. Aircraft and Zeppelins reached the coast beyond the front lines. Multiple bombing raids took place at the training camp, and the hospitals were hit in spite of those clear rooftop markings that I pointed out. This is what it looked like after it was bombed. There were many casualties, troops in training, and the wounded and medical personnel, including several of Maude's nursing sister colleagues. People were quite cut off from home. You may have heard of censorship during the war. Every letter, every postcard that anyone was sending could be censored. They needed to control information about the troop movements, so people couldn't say very much about what was happening. Maude wrote one letter while she was on leave in Killarney, Ireland, that we still have. It was shortly after one of the raids, and this is what she said about it. She's writing to her sister and brother-in-law. Dear Mabel and Clayton, here we are in the Emerald Isle. It scarcely seems possible, does it not? It is true all the same. Did I write you from Le Tréport? I forget. Well, I will just give you a brief account of the last month or so. Suppose you saw in the papers of the air raids we had at Étape. The first of much account was the 19th of May. After that, we had a few, and a very bad one again the 31st of May. During the time from the first to the last one, we went out in the pine woods to sleep while our dugout was being built for us. And as it was not yet completed, and the raid was so severe, we needed to stay out. The 31st, quite a number of the girls were sent away, and me amongst the 33 sent to Le Tréport, although I would have much rather remained at Étape. Eventually, the war ends. Maude comes home. We have some of the items that Maude used in our collection, thanks to a donation. This is Maude's invalid feeder that she would use with patients who couldn't feed themselves. Liquid food would be put inside. You'll also see a pot and burner for heating things up, as well as a syringe kit and Maude's helmet used when there were air raids or when she was on ambulance convoy duty. This is a gas mask with case that would be carried by soldiers as well as the nursing sisters to protect them in the event of a gas attack. The helmet is one similar to what Maude would wear. Service medals. These are medical instruments that Maude would use or assist doctors. The arrow-shaped one is called a bone file, and the tongs are bullet extractors. Then we have a soldier's housewife kit with straight razor, cutlery, toothbrush, and a brass button polisher, as well as a brush. Then socks, home knit and sent to soldiers, puttees that were part of the uniform at the beginning of the war, and a cartridge belt. Again, this is soldiers. As time passes, she grows older. This is a picture of Maude and Mabel in 1956 with their grandnephew Bob. Maude is on the left. She went back to Breslau and West Montrose, and Maude was a much-loved aunt and great-aunt until her death, September 9th, 1968, at the age of 83. She's buried at the Bloomingdale Mennonite Cemetery. This is just one example of one of the people sent overseas and their experiences. Thanks for watching.